So I'm Arthur Gianelli. I'm president of Mount Sinai St. Luke's Hospital. So the Mount Sinai Health System Experience was an amazing opportunity to bring over 3,000 of our employees together in small group sessions over the course of 3 months for 4 hours at a time, where they were able to interact with one another across a wide variety of disciplines to talk about what it means to be part of the Mount Sinai Health System. What is our mission? What's our vision? What are our values? What are the behaviors that we think are important? What do we believe about diversity and inclusion? Where do we see our strengths, and what it is that we want to do in the New York City market, in the region, in the nation, in the world to change healthcare.
My name is Michael Shapiro. I'm the Director of Food and Nutrition here at St. Luke's. I think there needs to be conversations about what the Mount Sinai Health Experience is for. You know, without giving the entire thing away, but your staff can't just show up to this round table with a big picture on it, not knowing why they're there. They need to kind of understand what this is for, why they're doing it, because they'll be a little bit more open-minded.
Hi, my name is Susan Ignacio. I am a nurse manager on 8 East at Mount Sinai St. Luke's. I had been working on creating a team. So team building was part of what we were doing last year, which was part of the coaching that we had.
My name is Maxine Legal. I'm the Assistant Director for Patient Experience at Mount Sinai St. Luke's. I think the response was really good. I think that when you bring people to the table and start communicating and dialoguing with them around patient experience or values or looking at specific scenarios and how you would handle those, I think that people feel included. They would even be brought to a table to have that discussion, and that was something that we really saw initially. A lot of people said, I've been here for 30 years and no one's ever asked me this.
My name is Lisa Renaud, and I am the practice manager for Mount Sinai Primary Care Assisting Specialty. For my staff, they were just completely blown away to have this opportunity to sit in a room with a diverse group of people from all different levels of management and to really talk about what it is that Mount Sinai true desire is, and that is extraordinary signature care with our patients. I absolutely loved it.
The staff, they were really excited about it. I spoke to different groups of people after we did the training, especially people that you wouldn't expect to be positive, some of the more challenging staff. They liked it. They liked the picture guide. They liked that they were able to see different things and kind of get up and touch and talk about things.
You go to a session and you'd see someone who attended and you're like, I don't know what to expect from this person, and they were engaged, they were bringing people along, they were leading their table. I think that was surprising.
While going through the sessions or
what do you mean, Stephanie? There were no challenges. No, not at all.
Having to schedule staff.
Keeping enrollment going.
The struggle is scheduling the staff.
So I think it was more of the scheduling, because you're still running a practice.
3,000 people to sign up for 4-hour sessions.
Driving enthusiasm, keeping enrollment going. That was crucial. That kept me up at night. So again, we really relied on our managers to get people registered.
And then also from time to time during the sessions, folks would see that as an opportunity to express perhaps some concerns or frustrations that have been pent up for a while that they had an opportunity to really voice. But, you know, that problem really is an opportunity to engage the concerns that our staff may have and to really address them in the context of discussing the Mount Sinai Health System experience and discussing what's important and what we value the most here as employees with Mount Sinai.
And in our department specifically, we do huddles twice a day. We've been doing them for 4.5 years since we got here. And we talk about the value of the month. We talk about the Mount Sinai Health Experience. We're, around our huddle board and talking about different things that are good or bad or are ugly, what we could do to do better as a department and work together with our partners in the hospital.
We have lunches together and we talk about our experiences, the whole staff. We get them together to share what can we do better within the practice, and we implement some of their ideas because it's just as important for them to tell us what we can do better. And I think through this whole experience in attending this class, we got the opportunity to believe and to think outside of the box and understand why we are here every single day.
We're much more cohesive, and we're much more together as a team. And teamwork is so important here at Mount Sinai St. Luke's and in the Mount Sinai Health System. And I think the experience really helped to foster and create that sense of teamwork and mutual support that's carried over even beyond the time period since the experience has ended.
I noticed that staff have become more sensitive, and it's quite amazing to see everyone participate and want to do well. It has become a friendlier environment, knowing that, you know, we are all working towards a common goal.
And having them come back and share with me everything they learned, how they're going to change how they work with patients, how they're going to work differently with each other, was one of the most exciting things for us, because it came from them versus us telling them what they need to do. And you could feel the vibe and the sense in the practice, the sense of community and how we work together, from people who just started to people who've been here for 20 years. Everyone has that same sense of ownership and pride to be part of the Mount Sinai Health System.
Have fun. You know, you gotta be willing to have fun.
Let it live. Don't let it die. Let it be part of your day-to-day workflow. Remember why we are here, and this class can teach you that. So if you continue to do that every single day, your people will see all that they have learned from it. That would be the #1 advice.
We just need to listen to the staff. They have their own ideas, and a lot of times hearing their ideas, knowing that it's coming from them, produce more than for it to come from us. So listening to what they're saying.
And remember what you're talking about. You know, you're talking about the culture of this organization. You're talking about what our current state, what our current state is, but more importantly, what we want our ideal state to be. And that is key, because then that's the goal. And if we keep that at the forefront, then it makes the work that we're doing more worthwhile.
Dive in, have a great time, put your entire effort into this, and the benefits of the work will be substantial.